Kidney disease is a chronic illness, but you can still live. You can still live your best life. And that's what NKF, National Kidney Foundation, has taught me.
It's meant a lot to have almost like a friend in your corner, to help supporting you, because they understand the significance of it.
26 million American adults have some form of kidney disease. The vast majority have no idea whatsoever. The NKF has instituted programs on all three pillars: awareness, prevention, and treatment, so we can positively impact the lives of all of our patients on every level.
I suffered high blood pressure for about 12 years that ultimately turned into kidney disease. So I made it my business to bring attention to my community, to my friends, to the world, because this is something that 26 million people are suffering from, and the numbers are growing. It's affecting the whole planet.
Supporting the movement, creating awareness for the National Kidney Foundation, so it's a beautiful thing.
National Kidney Foundation has been a great resource for someone like me, someone who was unaware that I was suffering from a disease for my whole life. I want to make sure people who are young especially still see that there are possibilities, and what they can do to help themselves and others is to advocate.
Government Relations provides advocacy and public policy resources to patients so that they can identify issues that impact their care and then take action to either fight proposals that could lead to adverse outcomes for patients.
It's really, about life and death. If people don't know they have the disease, there are unintended consequences for them. And kidney.org is a fantastic website. It's really easy to use, it's patient-friendly, it's easy for family members to navigate and get information that is needed and necessary when it comes to kidney disease.
Once I found out I was sick and needed dialysis, it was very traumatic because, again, not having any idea that I was really sick, I had very few symptoms that I'd normally associate with kidney failure. And just kind of all of a sudden going from working, had to leave it because I found out I was sick, and so I couldn't continue working anymore.
The Keep Healthy program is a free public health screening program.
Most people find out about kidney disease very late in the course of disease. The importance of this program is to make people aware much sooner.
The early detection is so important because when it's caught early, there's medications and there's treatments that can help, prolong the life of someone's kidney to keep them from being on dialysis or even receiving a transplant.
People are looking for information. It's helpful to ask questions. Sometimes the physician visits are limited and there may not be enough time to address questions.
NKF Cares is a really important service that we offer because people are able to call and speak with a live, professionally trained person who can help answer their questions that they have about chronic kidney disease. Often people are very nervous when they first are diagnosed with kidney disease, and this is great that they're able to call and speak with somebody who's knowledgeable about how to treat kidney disease.
The greatest impact we can have is through early detection delivered by the primary care clinician. The major strategies that we have to reach primary care physicians are our website, through education, CME credits, and also our symposia that can be used by nephrologists, volunteers, to educate primary care clinicians.
I found out in October of 2011 that I had IgA nephropathy. I hadn't been tested for any sort of kidney failure, and so I was lucky when we caught it when we did, because my kidney function at the time was less than 5%. The National Kidney Foundation has been a huge resource for me, and so it's just been real great to have an organization that understands the significance of kidney disease and advocates on behalf of myself and other patients that are affected by it.
So the National Kidney Foundation advocates for expanded Medicare coverage of immunosuppressive drugs for kidney transplant recipients and better access to dialysis care for patients. We're also advocating to protect coverage for dialysis patients so that they have access to the treatment they need, and also to ensure that the Affordable Care Act meets the needs of kidney patients.
NKF Peers is a program whereby patients who have kidney disease can talk to other patients with kidney disease and understand experiences, discuss issues that maybe physicians who never had chronic kidney disease would not understand or would not have experienced. And I think it's a special place. It's a mentorship program in a sense.
Well, I feel very good about being able to raise money, raise awareness for the organization, to help others, and also, the people that are involved are just good, everyday people.
I have someone that I can turn to when I have problems, when I have questions.
And without them, I would have been walking alone.